Hi, my name is Diana. Welcome back. Today we're going to talk about using the nursing process and prioritizing our patients. This is going to help you answer some of those tough nursing questions on the exams and how to prioritize your patients on the floor. So let's start with the nursing process. I like to use the acronym ADDPIE. So let's go over the first step. The first step is assess. Before you can do anything, you've got to assess your patient. If you've got a test question and it's asking you in the process, which one are you going to do first, it's always assess. You don't know what to do next with your patient until you know what's going on. So part of that assessment is data collection. I often forget this point. I think that it's not part of the assessment, but it really is. You've got to have your vital signs, and say your patient might have a urinary tract infection, so you've got to collect that urine before you can do anything else. You can't say, oh, let's give antibiotics if you don't even know and have a confirmed infection. The next step to the process is analysis. We've got to analyze what's going on with our patient. We have all the information that we need, so what are we going to do next? The next step is plan. We want to figure out what are the patient outcomes do we want for our patient. Do they need to get up and walking so that they can avoid blood clots and constipation? Those would be outcomes, and so we need to have a plan of action of how we're going to get those desired outcomes. Then we've got to implement that plan. Implementation, that's the next step. So we've got to take our plan that we've created and implement it. We've actually got to do it for our patient. The last one is evaluation. Now that we've assessed, we know what's going on with our patient, we've come up with a plan, we've implemented it, now we've got to evaluate it. Did we get the patient outcomes that we want? Did they not get an infection? Were they able to walk around? Evaluation. This is our last step. We've got to see what our patient outcomes are. So this is the first step in figuring out how to prioritize our patients. So the next step to prioritizing is using a framework. We're going to go over 4 different frameworks to help you figure out which patient to see first. The first framework is your ABCs. I'm sure you've heard of this one. It's airway, breathing, and circulation. If you've got patients that can't breathe, that have a closed airway, that aren't circulating properly, these are your priority patients, because without those 3 things, there's either going to be severe injury or death that occurs. So first, you want to look at the airway. That is number 1. If they don't have an open, clear airway, if they're not getting enough O2, then this is the first thing that you need to do. If their work of breathing, so this would be the second step, the B, breathing. If their respirations aren't adequate, if they're breathing too slow or too fast, if their work of breathing, if they're using their accessory muscles and not their diaphragm, this is going to be the next thing that may need an intervention. The C is circulation. Are they perfusing properly? Are you seeing a good cap refill? Are you feeling pulses in the distal ends of the body? This may need, includes your blood pressure, your heart rate. Are those things working adequately so the patient is stable? So this one's a pretty easy one that we talk about a lot. The next one is acute versus chronic. This is different. So that if you've got a patient who is having an episode of acute pain, say somebody's got some back pain going on, but it's an acute, it's sudden, it happens really fast, it wasn't expected, versus somebody who has chronic pain, like chronic back pain, that they have been trying to treat it, maybe they're on chronic pain meds. Out of these 2 patients, you're going to see the acute patient first. They are your highest priority because it's new, it's sudden, we don't know what's causing it possibly, and so we want to check out them first, opposed to the person who has chronic back pain, who they may need just an adjustment in how they're managing their pain. The next one is urgent versus non-urgent. These patients might have a time-specific intervention that needs to be done. So think of your urgent patient. Say if a patient is diabetic and needs their blood glucose checked before they can have breakfast and have insulin, this would be an urgent need if it was your morning shift. You'd want to see them first over somebody who's non-urgent, who says may need some pain medication, but they don't need it right this moment, like your diabetic who would need maybe some insulin. The last one is stable versus unstable. These are your patients that maybe have unstable vital signs that need attention. So say your CNA went in there and took their vital signs and came back with a heart rate of 120, which isn't normal for this patient. This patient would need to be seen over somebody who had stable vital signs that were doing okay. So we're going to go through a question and to figure out if you can decide which patient needs to be seen first. Okay, so let's talk about client A. Okay, so this client is 2-hour post-op, has a pulse of 88, has a BP of 128/48. Nope, sorry, got that backwards, 84. Has a respiratory rate of 15, has a temp of 99. So that's client A. Client B is 4 hours post-op and it is having 8 out of 10 pain. Client C has some nausea, maybe some vomiting, and hasn't eaten or drank for most of the day. Okay? Client D is 4 hours post-op with a cast on their right arm with numbness and the fingers. Okay, so now we've got our 4 different clients. We need to figure out which one's going to be the priority that we need to see. So let's talk about each one of them. The first client, 2 hours post-op. Let's look at the vitals. We've got a temp of 99, a little high, but still within that normal range, a pulse of 88, BP 128/84, and respirations at 15. So they're actually pretty stable. Even though there's a slight temp after the surgery, it's not doing too bad. We do need to check on them because they're going to be post-anesthesia, so they might have a dip in their respirations. We want to make sure that they're coming back and recuperating adequately. Patient B, we've got 4 hours post-op, and they are an 8 out of 10 pain. Now, this is included in our vital signs, and this would be higher than what we'd want it to be. But is this really going to be cause for an urgent demand? If we're looking at our priority frameworks, urgent versus non-urgent, is this going to cause the patient any more adverse reaction to having pain for a little bit longer? We don't think that this is really a priority. Client C, having some nausea, some vomiting, hasn't ate, hasn't drank. Now this is something that we would cause for concern, right? Like they need to have adequate nutrition and fluid to be healthy, to recuperate, to not cause any more damage. So this is definitely something that we should check into, but is it the priority? Let's look at patient D. 4 hours post-op, they have a cast on their right arm, and they're starting to have numbness and tingling. Let's look at our frameworks. Which one can we use? If you think about it, numbness in the fingers after a cast, especially 4 hours, is not a normal finding. If we think of our ABCs, that is our highest framework that we should be using with each patient. This patient is actually the priority. Even though all of these patients need to be seen and they need to be checked out because they are all very important things, D is actually the most important because the numbness and tingling is due to maybe a decrease in circulation. So that means our priority framework of ABCs, this would be our priority patient. We don't want them to have any more injury caused from this cast cutting off circulation to their fingers, so we would want to see them first. So you can see, you can use priority frameworks to figure out which patient to see first, like we've done here, using your ABCs, your acute versus chronic, urgent versus non-urgent, and unstable versus stable, and also using your nursing process. Remember, add a pie. Assess, data collection, analysis, planning, implementation, and evaluation. These are just a few things that you can use when answering those questions and figuring out who's the priority on the floor. All right, good luck.